I'm Dr. Joe Niamtu, and I want to talk to you a little bit about the Blaine Lab vibration device. And this is a neat little thing that uses the gate theory of pain control, and it's battery operated. It's very ergonomic. It fits well in the hand. There's an activation button. When you activate it, it vibrates. I guess you can hear it. And it has a little blue light that kind of shows the area of active vibration or pain control. And we use this all the time for our neurotoxin injections, and we use it for filler injections as well. And again, it operates off of the gate theory of pain control. The thalamus is the part of our brain that senses pain and discomfort, and there are inhibitor neurons and that can be stimulated by a vibration source. And it's kind of a complex theory how this works, but the bottom line is it attenuates the feeling of pain sensed by that part of our brain, the thalamus. And a more simplified way to look at it is when you have two simultaneous stimuli, it's hard for the brain to figure out which is which. So the vibration, where we use for the fillers or the facial injections, it does several things. Number one, I mean, it definitely distracts the patient. They're feeling this, they're thinking about this, so it's a distraction, and that's part of the effect. But also the science of the gate theory of pain control, it makes a difference. I can tell you this, when I get Botox or Dysport or Xeomin, I make my nurse use this. It definitely makes a difference. We've done little informal studies where we've done one side of the injections with it and one side of the injections without it. Or really, the proof is in the pudding. When we use this on patients, when they come back, if we start to inject them without it, they say, hey, wait, where's your little vibrating device? So I think it's a neat little thing, and it's made by Blaine Labs, B-L-A-I-N-E. This is Dr. Joe Niamtu, Love That Face treatment, and we're going to demonstrate the Blaine Labs vibrating device, which I do use when I do injections. I think it makes a difference. We have done this little informal studies on patients where we did one side with the device, one side without the device, one appointment with the device, one appointment without the device. And I'd say 99% of the patients feel that it does something. And every once in a while somebody doesn't like it, but that's really rare. And when I get Botox, I'll tell you right now, I make my nurses use it because I think it makes a difference. And basically, it's the gate theory of pain control. And our brain, the thalamus in our brain, is what senses pain. And there are inhibitor neurons that are stimulated from a vibration source. And to simplify it, it's really difficult for the brain to interpret two different stimuli at one time. And what happens is this is naturally a distraction to the patient. So when we're turning this on, it's vibrating, it's making some noise, and it's a distraction, and that helps as well, but there actually is science behind it. And the device is nice because, first of all, there's a little light that you can see, and that light kind of shows you the area of active vibration or pain control. And this little plastic piece on the front, I like that as well because I can stretch the skin or position the skin with it. And it's pretty ergonomic, and it's just set up well to use for injections. Alternately, you can have the staff do this while the surgeon does the injections, but I tend to do them both at the same time. We're going to do some lip injections here, and we have not used any local anesthesia. We put a little topical anesthesia on, and we're going to use a vibrating device. So I'm going to tell the patient right now, this is just the vibrating device, so I'm letting her know what it feels like. And this is a little bit of Juvederm, and we're going to put it right in here. So I'm vibrating, and we're going to inject right here. She's doing great. And we're going to do a little bit more over here. And not all patients can tolerate this. Frequently we use lidocaine, but I can tell you from using this device on myself that when I get injections with it or without it, I can definitely tell a difference. A little bit across the front of the lip, Another thing I like about this device is you can use this little clear area to retract or manipulate tissue. And we're going to inject across the front of the lip. So I think you've seen the most common applications that we use the Blaine vibratory device for in our practice. Back again with the Blaine Labs vibratory anesthesia device, and this application we're going to use some local anesthesia injection for filler. So on this patient we're going to fill their tear trough in their upper cheek area with in this case Restylane filler. So what I always do is make my patients numb beforehand, and although we use a 1 cc syringe and a 32 gauge needle, you know, it's still a little bit uncomfortable. All this makes it tolerable, but when I use this device, this will help. So I'll show you how we do it. I'm going to tell the patient that she's going to feel some vibration, and we're going to insert this. I usually put about 0.1 to 0.2 cc's of local anesthesia in these areas. We're going to go to the other side here. So again, the vibration helps as a distraction, and it also helps as a physiologic example of the gate theory of pain control. So that's this application for local anesthesia. Radio wave mole removal here, and again we're demonstrating the Blaine vibration device with local anesthesia. So this is another area where I would use this when I'm doing local anesthesia, and it just makes it easier for the patient to have injections when you're using this. And believe me, if you use it on somebody once, they'll come back. They'll if you don't use it the second time, they'll ask you about it. Moving right along with different clinical cases to illustrate our injection technique with the Blaine vibratory anesthesia device. We're going to put some vibration here, and we're going to anesthetize this little nevus that we're going to ablate with radio wave surgery. So I usually put about 0.3 of a cc in there. And we're going to do this one here on the cheek. And that's normally a pretty sensitive area. So the other nice thing about this, just besides the vibration, it allows me to hold this up and kind of move it to help position the needle, so I can actually move the tissue up a little bit, get a little bit more local inside there. So another application. Dr. Joe Niamtu here, and we're again continuing our saga of the Blaine vibratory anesthesia device, and you got to practice what you preach. So I'm going to get injected here with this device. So it's a pretty significant vibration. I mean, you can really feel the vibration, and I can't feel the needle going in at all. So I think it does make a lot of difference, and I'll be honest with you, when my nurse injects me, I make her use it, okay? So I guess I'm a little bit of a wimp, but I guess that's why we use this device to deliver painless injections.